Okay, let's start. I think it's not fair to all of you who are on time with us. So if people come later, it's okay. They will miss just the introduction.
Right, and the session's being recorded so they can see anything they missed later.
Yes.
All right, so hello everyone. Welcome to the ICUDDR virtual conference, Sustaining and Adapting Addiction Science to Virtual Realities. My name is Jessica Keene and I am the moderator for this session, and we're very glad you joined us today. If you would like to ask questions during the session, you can put them in the chat, or if you would like to speak at any point, you can raise your hand and our presenter, Matej, can call on you to speak. So I'd like to welcome Matej Košir. He is the director of the Institute of Research and Development, UTRIP, in Slovenia. He's been working in the field of prevention and advocacy for more than 20 years. He's the co-author and co-developer of the European Prevention Curriculum and the contributor to the second updated edition of the UNODC WHO International Standards on Drug Use Prevention. He is a PhD student in preventive science at the University of Zagreb in Croatia, vice president of the International Confederation of Research Associations in the field of alcohol, tobacco, and other drugs, and deputy chairperson of the Vienna NGO Committee on Drugs. So I'll give the floor to him.
Thank you very much. I'm really pleased to facilitate this workshop, to run this workshop for you. It's quite popular also during the COVID-19 period, the knowledge and skills on advocacy. There is a huge need, an increasing need for these knowledge and skills, and I'm happy that I'm able to share these knowledge and skills with you. Most of the content of this workshop is based on my own personal experience as advocate. When I started with my career in the field of prevention, I never thought that most of my work will focus on advocacy. I thought if you bring the evidence to policy and decision makers, they accept it easily and say, okay, this is the way we are going to do it. But very soon I found out that it doesn't work like this because you need much more than just evidence to convince policy and decision makers to change their minds or they adopt some particular prevention-related policy measures. So it has been a quite long journey for me and for our group in Slovenia, our advocacy coalition, to make some progress, especially in the field of tobacco policy. We are proud to say that Slovenia is one of the top countries in the world regarding strict tobacco policy. We were able to push also plain packaging in the law. So we are very proud of our work in the recent years. So, but I will not explain too much about my experience because it would be too long introduction. So we will start with the content of this workshop. So the main objective of this workshop is to give you some knowledge, some hints and tips on how you can inform policy and decision makers about evidence-based substance use policy and practice. Because as I said, those skills and hints and tips are very valuable in our prevention, especially in our work in the field of prevention. And as a subtitle of this workshop, you can see it on the slide. We define advocacy also as a weapon against mass destruction because we know how much harm and devastation is made by unhealthy industries, by different non-communicable diseases, by alcohol, by tobacco, illicit drugs, and also other risk behaviors. So we really can define a good and evidence-based advocacy as a weapon against mass destruction, if we can use this quote here in this context. So I would like to hear also some words from you. You can write it in the chat. You can also raise your hands and tell to everybody. So it doesn't matter which way you use it. Usually people prefer to put those answers in chat, but I would really like to know a little bit about you, about participants of this workshop. So please write about your experience with advocacy or advocacy training in your career. Or you can also briefly present at least one experience with advocacy. And also, I would like to know what is your opinion about effective advocacy. What do you think is effective advocacy in the field of prevention? So you can write those things in the chat. We will stop a little bit in between after the short presentation of advocacy, and then we will discuss also about your experience and opinion on effective advocacy. So please feel free to write it in the chat, or if you want to say it, just raise your hand. We will follow your wishes. So the key topics in these advocacy trainings are as follows. Usually our trainings are much longer than this 90 minutes workshop. This is more or less introductory workshop. We just present what we can offer in longer, more interactive trainings. First of all, we have to go through definitions and terminology, because still people mix different terms, different definitions on what is advocacy, what is not advocacy. They mix quite a lot between advocacy and lobbying. Still some people mix between advocacy and social marketing, which is even harder to understand sometimes. But from our experience, we know that people still mix definitions, and they sometimes don't know what we mean with advocacy. So first of all, we have to define what we are going to talk about. So advocacy is, especially if we compare it with lobbying, which is more popular word in this field, advocacy is more like educating policy and decision makers about some relevant topics and policies and practices. And lobbying is usually pushing the vote. So you go to the parliament and you say to the politicians, this is what we expect from you to vote for particular policy measures. Sometimes lobbying is the last phase of advocacy. When we do all these educating phases, when we bring all the arguments and evidence on particular topic, then we go to the parliament and we say, okay, this is what you know now about this particular issue. So we expect you to vote yes or no. So lobbying is something which is, just pushing the vote, further, and advocacy is a much bigger story. It's more about educating, informing, bringing evidence to policy and decision making, so they can make good decisions in favor of public health or prevention. So then it's also very important to know at least something about policy and decision-making processes or policy cycle, because most of us are not familiar with those processes. Most of us never go to the parliament or to the governmental institutions to discuss. So we don't know those processes. We don't know which committees or commissions are responsible for example, for prevention or for public health. Usually we don't know that. So it is very important for us as a future advocates to get familiar also with policy cycle, to understand what doors we should knock on, who are the most responsible people for the most relevant decisions of our advocacy campaigns. So those questions are all very relevant. So we have to be familiar also to some extent with policy and decision-making processes. So we know where to go and where to knock on the doors, to which politicians, which policymaker is relevant for our campaign. Also, we cannot act alone, so we need to build successful and effective coalitions. So we will also, I will also tell you something about some hints and tips on how to build effective coalitions. And finally, it's also very important to make the case with media. So media advocacy is, I would say, more and more important in advocacy work. Because with media, you get media coverage, you get attention from policy and decision makers, much easier than with some traditional indirect ways of communicating with those people. And also at the end, I will give you just shortly some hints and tips also on how you can develop a good and effective advocacy plan. So just to see the chat, there are some inputs already. Okay, so people are not sure if they attended advocacy training, some trainings on implementation of prevention work in the community. Yeah, we have to also understand that there is a difference between community mobilization, so-called community coalitions, and advocacy coalitions, because the target group in advocacy are only policy and decision makers, those who can put our objectives, our action, our arguments, and our proposals into policy and practice. So this is very important to distinguish between community coalitions, which are more responsible for coordinating, for developing action plans, to evaluating and monitoring prevention interventions, etc. But in advocacy, our target groups are policy and decision makers. So this is very important to know. And I would say that you most probably participated at the community mobilization training. Yeah, somebody wrote that she remember representing our organization in cannabis roundtable discussion in our country with different stakeholders in government department. That was probably advocacy. It depends on, probably you were on the side of science. You brought some evidence based on, what can decriminalization or liberalization of cannabis policy bring to the society. So this was most likely advocacy activity in discussion with different stakeholders and government departments. Okay, great. So this is what we have in chat. So you're always, during the whole workshop, free to write about your experiences. You can write your questions if you have some doubts about what I'm going to say. So I will check chat. I will try as often as possible to check also the chat. So and then we have to go into some details to explain advocacy maybe in more details. So advocacy means includes different kind of activities and actions, or by individual or group. Maybe by individual, in our field, we are not very likely to be successful as an individual. We are not a kind of, Bono or Sting. They have a direct access to high-level politicians at global level or also at national level. So they can be advocates as individuals because they can do it with their popularity, their influencers. Also, politicians like to meet them because they are famous celebrities, etc. But in the field of prevention, we are usually not that famous. Not that attractive for policy and decision makers. So it's more likely that we will set up a group of stakeholders, a group of people advocating for particular policy decision. And with intention, of course, of influencing policy and decision makers. It's not just influencing policy. It's also influencing resource allocation decisions, the funding. It's extremely important that we include also funding decisions in our advocacy activities, because we can change policies. We can even change some practice-related interventions. But if we don't assure funding for evidence-based policies and practices, it will not take long before everything will disappear. So we have to assure also in the long term the funding. The funding decision. We have to influence also funding decisions, and also our aim is to develop, establish, and change policies and practices, because although the policies are implemented already in practice, we have to monitor. We have to try to influence also improvements and future changes of the same policies. So this is a long-term process. This is an ongoing process being advocate in this field. And also we have to also be aware of to advocate for establishing and sustaining evidence-based programs and their funding. This is a long-term process. So we have to monitor what policy and decision makers are doing. We have to monitor also what our opponents are doing. For example, unhealthy industries are doing. So we are always ready to jump into this process and try to prevent some negative changes of legislation. So this is very important for us to be aware of the whole scope of advocacy activities. Advocacy can include many activities. Maybe most of us know advocacy for media campaigns, for media public speaking. So this is the most popular way of doing advocacy. But it's also more professional expert work. We can commission or publish some research or polls and use these results of research and polls in our advocacy activities. We can also file some briefs or additional arguments or amendments or complaints. We can start petitions about some particular policy issues. So there are a lot of things we can do as advocates in the future. And why? I already spoke at the beginning, but it's not a problem to repeat it again. Why advocacy is extremely important? There is an increasing need for this knowledge and skills because we feel sometimes desperate. We bring a lot of evidence, we bring a lot of good arguments, but policies and practices and funding don't change. So policy and decision makers, they don't care about what we have to say sometimes. So we are sometimes very desperate and not very motivated. So this advocacy knowledge and skills can really help us to bring some, to get some media attention, to get some attention from policy and decision makers. And those knowledge and skills are essential for not just for practitioners, which is usually a natural role of, for example, civil society. Advocacy is a kind of natural role of civil society organizations. But more and more, it's important also amongst prevention scientists, researchers, and of course, practitioners to potentially influence policy and decision-making processes. It doesn't matter, is it for better prevention-related policies or practices, or long-term sustainable funding, or also research and education training programs. So we advocate also towards educational authorities to support our education and training program. So this is also important for this part of our field. Especially those skills are important in public health areas where we know unhealthy industries are influential, and they want to be important stakeholders. They knock on the same doors pretty much or maybe to some others as well, maybe more to ministries or departments of finance, or maybe departments of economy or agriculture, but they do knock on several doors of policy and decision makers. And especially in those fields where they are present quite strongly, we need good and effective skills and knowledge to be good opponents and to defend public health and prevention related decisions by policy and decision makers. This is just to show you one good example how alcohol policy is well organized at the European level, which means in Brussels and Luxembourg, where European Union's institutions are present. And European policy and decision makers make the key decisions for the future of the European Union. So this is a network of different institutions. It's not just the alcohol producers. It's also marketing associations, also some NGOs established by alcohol industry. There are also some sports associations. I mentioned already marketing. There are some trade unions, agriculture associations. So there are a lot of different stakeholders, different lobbyists, and approximately 500 to 600 people in Brussels work only for alcohol or tobacco industry. So this is a huge number of lobbyists, people who are well trained, who have good rhetorical skills, and they are always present in the halls of European Parliament, European Commission, etc. And we are maybe only few organizations present in Brussels, and mostly we have one office with one secretary and flower there, and we are not very strong, especially if we try to compete with industries. So it's even more important how good and effective knowledge and skills on advocacy we have, and that we are really familiar with all those processes and where to jump into discussions, which doors we have to knock, which policy and decision makers we have to invite to support us, etc. So it's extremely important for us that we are really well trained with good knowledge and skills on advocacy, so we can make some progress also at such level, for example, at the European Union level or at the US federal level, no matter which country we are in. And also those few bullet points are also very important. There are more, but I try to summarize them into the most important ones. With advocacy, we can forge really strong relationships with policy and decision makers in the long term, and also other key stakeholders in the field, especially those who are responsible for prevention-related or substance use related policies and funding. Our advantage is using research to inform policy and decision makers. Of course, industry and health industries will also bring some evidence. They have their own universities, their own scientists who work for them, but I would say just approximately that 99% of scientific arguments are on our side. And we have to learn how to use this 99% of evidence, because otherwise their 1% will be on the agenda of policy and decision makers, not our 99%. So we have to really try. We have to try to balance this information about evidence and research, and we have to use much better support from science and research than our opponents. And also, it is important with good knowledge and skills on advocacy, we can provide expert testimony if we are asked to do it in the parliament or local council, city halls, etc. No matter where we are invited to speak, or in the media as well. And not least or not less important, we can also learn how to write good position papers, press releases, social media posts, how we can organize effective press conferences. This is all what we can gain from good advocacy training. And also, it's very important, this came later on our slide, we can increase the visibility and recognition of evidence-based related policies and practices. So this is also important, not just in the process of influencing policy and decision-making processes, but also to make evidence-based related policies and practices visible and recognized by different stakeholders, including media, including responsible authorities, and also general public as well, people, voters, for example. And advocacy should be ongoing activity. It's not, sometimes it might happen that this is a kind of ad hoc. Something happens and we jump into this process of advocating for some better solutions. But in the long term, we should be committed to ongoing advocacy, because you never know what the opponents are doing. You always have to monitor them. You always have to monitor policy and decision-making processes, so you're familiar with what is going on in your field from the perspective of policy. I already mentioned the importance of policy cycle, that we are familiar with different phases of policy cycle. And why is that? Most of the time, as advocates, we are present in two phases, which are adoption phase and implementation phase. And most likely this is very late in this process, because when a legislation is in the parliament already, in the process of adoption, most of key decisions were already made at the different interministerial working groups, in discussions between political parties, a governmental coalition at the government, etc. So when those decisions come to the parliament, is already very late. It's not impossible to change some minor things, but about the key policy decisions, we are absolutely too late in those phases. And sometimes it even happens that legislation is already adopted, and then we found in the I don't know, in the official journals, or when they start to implement the policy, we found out what they actually adopt in the government or in the parliament, and we are not, of course, satisfied, and then we try to make a noise and in the media, etc. And this is absolutely too late. Just to give you one example, there is an unwritten rule in Slovenia that tobacco policy changes every 10 years. So if we miss the opportunity of this legislation change, then only in 10 years we have another opportunity to make significant changes to the law. So this is something we have to know, and we should be motivated to jump into these policy and decision-making processes much earlier. For example, this is a phase of agenda setting written on the slide. It means that we contact political parties before elections so they can listen to us and maybe decide to put some of our arguments in pre-election programs. So they can promise to the voters that something will be changed if they are in the government or in the parliament. So this is something we have to accept as a best possible scenario, to contact political parties before elections and try to influence their pre-election programs and promises to the voters. Because later on, if they establish the government, if they're very strong in the parliament, you can always ask them, this is what you have promised to the voters, so please let us know when do you plan these processes or discussions. about some proposals of new legislation or new measures. So you can always ask them about the progress, about their promises before elections. And also it is important, it's not possible in every country, especially there are many countries in the world which really don't, the governments don't like a very powerful involvement of civil society organizations or maybe researchers. But in many countries, this is the possibility. In the face of policy formulation, there are a lot of, I would say, interministerial, multi-sectoral discussions between different ministries, different departments, different governmental offices or agencies on particular legislation. They develop legislation in this phase. They try to put some ideas, some proposals into a draft law or draft regulation. So this is the phase. If we are able to involve ourselves as a scientists or researchers or civil society organizations into those processes, we can really significantly influence this process with our good arguments based on science. So we are able then to discuss with other stakeholders at the same table about possible solutions. So this is a good and relevant phase of policy cycle for us as advocates to influence policy and decision-making processes. And when we come to the parliament for adoption phase, then our decisions are already incorporated in this legislation. So we can just stay there and watch and monitor the situation, some activities from the opponents, from unhealthy industries, for example, and just try to prevent those solutions from opponents are accepted or adopted by policy and decision makers. So it's much less worry, much less work in that phase if we were already present in the previous two phases. And evaluation phase is also usually what we don't use as advocates. So it is, sometimes policy and decision makers want to change legislation because they think it doesn't work without any serious evaluation or analysis. And they change legislation just to follow their own individual interests or political interests. But in this phase, we have to jump into this process as well with our arguments, with maybe asking them to evaluate seriously the implementation of legislation so we can find out where are the barriers. So maybe the barriers are not so difficult to overcome. Maybe barriers are only maybe to put some more funding, maybe to increase the number of people who work on particular area. So to empower or to strengthen the human resources or financial resources. So it's not necessary always to change the legislation and follow some other interests by political actors. So also evaluation phase is extremely important for us as advocates to be involved and to try to influence some decisions at the end. Also regarding building coalitions and developing effective coalitions, this is also a very important part of advocacy and also advocacy trainings. Because I mentioned already, it's not usually the case that we act as individuals. We could, if we think we are powerful enough to influence policy and decision makers by our own, it's also a solution. But usually we are a group of people, or there are a group of countries or stakeholders that join together for a common purpose. Common purpose is extremely important because we don't have common purpose, coalitions are not possible. We will start arguing against each other sooner or later. So common purpose is the first the first objective we have to follow in the process of building coalitions. And when building a coalition or alliance, which is more formal way of coalitions, these groups usually agree on how to behave, how to work together as a team towards a set of joint actions defined within the group. So it is very important to have a good plan, good behaving and working protocols, so we always know who is responsible for what will be the process of making or adopting common decisions, etc. So it's not necessary to have everything on paper, but in some cases this is also good to have just a kind of memorandum of understanding or something, a protocol of cooperation work, collaboration, etc. It's always good to have something written on the paper, which we all agree on how we are going to behave and work together. This is maybe just a very simple example of a coalition, important stakeholders for coalitions. I already mentioned that it is a kind of natural role of civil society to be present in advocacy processes, but not only civil society. They should always join forces together with researchers and professionals, especially at the universities, some research institutes. So together they are much stronger than if they are just researchers as a coalition, or just civil society organizations as a coalition. They can mobilize a lot of capacity, a lot of knowledge and different skills together. So usually in most of the cases, coalitions includes civil society organizations and professionals. But if we are able to include also some other stakeholders in coalitions, we will definitely benefit from them. For example, media. If we know some journalists, or we have friends or journalists in family, we can always invite them as members of coalition to help us dealing with media stuff, with the press releases, with contacting media in our media advocacy campaigns. And also, we can include policy and decision makers as well, depending on what is our focus. Is our focus, just to give you an example in alcohol policy, if our focus is to increase taxes or excise duties for alcohol drinks or beverages, then our target group or target ministry is Ministry of Finance. In this case, we can invite Ministry of Health or National Public Health Institute, or also some other ministries or social affairs, education, etc., to be part of our coalition and help us in these processes, because usually they are very familiar with policy, policy and decision-making processes at the governmental level. They know how legislation is processed. They know in which phases are particular laws or regulations. So they know exactly in which phases there are initiatives, policy initiatives, and it helps us a lot. So we know exactly when and where and to which doors we have to knock in which phase of policy cycle. So if we have an objective or a target to influence a particular ministry, we can also invite other ministries or other departments or agencies to be part of our coalitions. Usually they don't sit with us at the meetings, but are part of the processes of communication within the coalition. And they are very well, we like them a lot because they help us a lot with a lot of valuable information, especially about who might be our opponents, which politicians might be our opponents, which politicians or political parties might be on our side, or in which phase of the policy cycle is policy initiative. So we know exactly where we are and what we have to do to influence those processes. Also, in this topic, it's important to follow some steps if we want to build successful coalition. And that is setting common and compatible goals. We mentioned already common goals, because if we don't have common goals or compatible goals, we will have a lot of problems and barriers to reach some consensus with other coalition partners. And also we have to achieve some mutual benefits of co-working. So it's not that, you know, we will form a coalition, but only one or two partners or institutions will take the benefits from co-working. For example, they will be, you know, they will be acknowledged by different ministries or media, etc. So we should take care also about sharing these benefits of co-working with other partners. And also we have to ensure that benefits are surpassing the costs, because if the cost is bigger, then our motivation for advocating will go down, and sooner or later our advocacy initiatives will disappear. So we have to take care also about the costs. And of course, we have to speak also about the benefits of coalitions and disadvantages of coalitions. So you can please use chat to write some benefits of coalitions. What do you think are benefits of coalitions? What do you think are good things of coalitions? What we can benefit from them? Pooled resources, that's very good. Not just financial resources, but also human resources and knowledge. So more people, more knowledge, more skills, and it's much easier then to divide roles and tasks within coalition. This is a very good answer. Anything else? Strategic interventions. Yeah, it means that we are more capable to work with some more complex issues, where we need more strategic discussions and interventions. So more resources, human resources, more knowledge, more capacity we have, more complex interventions we can, more complex advocacy campaigns or more complex issues we can discuss with policy and decision makers. Sustainability, yeah, it's not it's not always the case, sustainability, because most of advocacy work is done by ad hoc coalitions. They meet for particular objective, and they do all the activities, they win or lose, and then they go to different directions again. But if we establish this coalition as an alliance and formalize it, like you know, we have so-called NCD, Slovenian NCD alliance in my country. So we have established entity and a secretary, employed people who work for us and try to organize us and organize meetings and trainings, etc. So in this case, this influences sustainability of our advocacy work as well. So this is also very good argument. Tackling issues from multiple different angles, that's for sure. More people from different areas we have in our coalitions, more complex issues we can tackle. That's very important. Capacity building of members. Yes, in a way, this is for a long-term or sustainable advocacy work extremely important, because we have different levels of capacity in coalitions. We have stronger, more powerful, financially more powerful institutions and also weaker members, newly established organizations or only organizations with few staff, etc. But we have to build capacity also of these weaker members of the coalitions, because we never know, maybe those guys will run advocacy campaigns in the future and will then take the lead in advocacy work. So you never know. Investment in all members, especially in weaker members, is very important. A group of people stands with common goals, have strong vibration in the environment. Yeah, not just in policy environment, also in media environment. If you come with a group of 5-6 organizations with a huge membership, also media, you can also attract much more media attention than if you're alone or only 1 or 2 organizations. So this is also strong vibrations. Yeah, they can feel it. They can feel your power, that there's your strength. They can be also afraid of you in a way. So they open more doors for you for discussion with you and bringing some consensus on the table. In political unstable contexts, you move forward. This is also, yeah, a lot of countries face political unstable situations, especially now in COVID-19 pandemic. And it's also important that if we are a strong coalition with a lot of relevant stakeholders involved in the coalitions, we can much easily move forward with our actions, activities, and also outcomes at the end. Push work on coalition priorities. Yeah, but that's a decision we usually make in advance. When we start some advocacy campaigns or coalitions, we set up priorities for our coalition. And it's always important that we go step by step. It's not good strategy to tackle 2 huge policies, like to tackle advocacy policy, not advocacy, alcohol policy as a whole. So sometimes it's much better to go step by step, to set up priorities. So we will first go for selling alcohol to minors, marketing, drink and driving, etc. So those kind of issues which are more likely to be successfully accepted for discussions, and also we can get to better results at the end. And slowly we come to the bigger issues of alcohol policy as a whole. Mostly you mentioned everything what is written here, so I will share my PowerPoint presentation at the end in the chat with all of you, so you will be able to read this. But I think, and I know that you mentioned pretty much everything what is written here on the slide. So there are also some disadvantages of coalitions. You wouldn't imagine it. So from our own experience, I can tell you sometimes are really stressful moments in coalitions. So please, if you have any idea what could be disadvantages of coalitions, write them in the chat, and we will try to discuss them. Conflict, competing agendas, yes, slow to move forward. About competing agenda, let us go back to the beginning. We have to agree on common goals and common objectives. Otherwise, we don't establish coalitions with partners with different agendas, different objectives and purposes. So we always have to be clear at the beginning that we have common agenda. So we don't have any problems later on in the processes. Members not committed. That's quite common, I would say. So especially in the coalitions of many members, many stakeholders, sometimes only a few of them work hard, and then the rest take the benefits as well at the end. So sometimes it is a good decision to discuss this balance of roles and tasks between different partners, so everybody gets some activities, some tasks to work on. Financial resources to implement action plans are sometimes a problem, but in our coalition, from my own experience, I can tell you that we are different organizations in the coalition. Some of us are more have more financial resources, and the rest, some of them are poor, if I'm able to say that. But this is really not an issue in our case. We always try to collect together the resources we need for advocacy campaign. This is why it is important to plan in advance. To also make a budget, to see what are the costs for advocacy campaign, and decide who will pay for what. And usually organizations who are stronger financially and also with human resources put more finances and more stuff in the work. This is normal for us, but I understand that this might be, this could be very stressful and not really pleasant situation in many cases, especially at the beginnings of coalition existence. So it is important that we take this into account, that we are different, we have different resources, and we put on the table resources according to our capacity. And we don't ask smaller or poorer partners to contribute the same amount of money or the same number of staff in advocacy campaigns. So this should be clear at the beginning of this process. So you mentioned some of them, so different levels of resources and overworking. Some members work more, others work less. So it is good. It is important to plan in advance, to have a good plan, distribution of roles and tasks, so everybody has something to do, important to do in the campaign. And also we have different levels of interests. Who knows what is the interest of each of us? Maybe we have common purpose, common objectives, but our interest is maybe to bring ourselves higher on the in the media. I would let's say more visible to media, more visible to ministers, to high-level politicians, but some others are more focused on the content. So they are more interested to push some policy measures forward. So we have different interests and wishes, and we have to balance sometimes a little bit those different interests. And also level of credit. Those members of coalitions who are more frequently in media get, of course, more credit. But there should be a clear criteria for who speaks to media. And then it's not a problem anymore. Sooner or later, people see that some of coalition members are more capable, rhetorically more capable to speak to the media. And one strategy we have in our coalition, we always train new people how to speak to media, how to do some media activities. So we take care of our future advocates in our coalition. So it's not just, I'm a public health or prevention advocate already for more than 20 years. In last few years, I'm not present in media anymore. Mostly other people took this responsibility, who were trained by us, by senior advocates in the coalition. And it's pretty much the same in the parliament. When our members go to the parliament to discuss particular issues, we, seniors, retired advocates, don't go to the parliament anymore. We sit in front of the computer and mobile phones, and we try to coordinate activities and also bring some more attention from media. So we have different kind of tasks. We act more or less like a masterminds of advocacy from the behind, and we are not anymore frontline warriors, if I can use these words. So we try to give credits and media attention also to other members, but this is a process, and there should be only one criteria for that: good skills in particular roles and tasks in advocacy coalitions. And also it is important to emphasize that we have different approaches to advocacy. Some people are more activist oriented. So they want to go in front of the parliament and shout and throw some stones or eggs into politicians, but this is more like activism. Advocacy is more with content. We have to educate and inform policy and decision makers. It's more like a diplomacy work. Could be also indirect. We can meet with them in a cafeteria, we can meet with them in the restaurant and discuss and maybe put some of our arguments under the table, not speaking loudly in media or in the parliament at the committees or commissions. So there are different ways of how we can do advocacy, and we have to balance between those different approaches as well. It's quite hard work sometimes, because people really, some are very explosive members in our coalitions. They want to go in media immediately, start shouting against politicians, but sometimes you can make more harm with such direct approach than wait a little bit, take a breath, maybe wait until the next day, and then discuss and jump into actions. So that's also important, that we have to balance those. It's pretty much the same like in our relationships, in marriage, for example. Coalitions work pretty much the same as couples in real life. So we have the same benefits and same disadvantages. We share benefits and disadvantages also from real life. So it's not difficult to imagine what are the benefits and disadvantages of coalitions. And we always have to make consensus and discuss again and make good common decisions, so everybody is happy at the end. So it's a quite challenging and difficult work to run such kind of coalitions. Also level of knowledge can rise a conflict. This is another disadvantage. But after a few years, if the topic is, I don't know, alcohol or cannabis policy or tobacco policy, we pretty much know who is expert in particular field. So after a while, we get used to each other. We know what are the advantages and disadvantages of each other. So we can pretty much easily decide who will present each topic. So we have this distribution of roles also by topics. But at the beginning, this could be a problem. And we should always have a professional criteria. If somebody is better, if somebody has better knowledge background, then we should push him or her into the fire with politicians or media. So that should be quite logical, I would say. Okay, let's go to the final part of this workshop, which is media advocacy. And in the last decade or maybe 2 decades, this media part of advocacy is becoming more and more and extremely important, because without media, we are not able to get, first, of course, media attention, and through media attention, we are not able to get attention from policy and decision makers. And we want to get attention from them. They're our target groups. And they are present in media. They use media, they listen to the media, especially high-level politicians, at least in Slovenia, that's the case. Every morning they get a bunch of papers on the table with extracts and summaries from different media about their area of interest. Or if it is, if he's or she is a Ministry of Health, for example, they get a bunch of papers, a summary from media about topics which are relevant for Ministry of Health, or which are which uses a name of minister in the news or in the interviews, for example. So it is important how we use media. Social media as well, it is the same rule. So if we are not in social media, we don't exist. And you know that politics are on Twitter. So if we want to be seen from politicians, we have to use Twitter in an effective way. We have to know how to use tags, hashtags, how to develop messages to be attractive. So politicians see them, like them, retweet them. So those are a kind of indicators of our success in social media. So, and we have to learn, and we can learn those methods and tools, how to use media, traditional media, and also social media. So a special module in our trainings is dedicated to this topic on how to use traditional and social media in our advocacy campaigns. And why this is so important. With media coverage, we can get a good attention amongst policy and decision makers, no matter of the level, national, regional, community leaders, depending on which media we use. If we want to draw attention amongst national policy and decision makers, then we go to CNN, BBC, ZDF, France television. So we go to nationally relevant televisions and other media. If we are more focused on local level, then we use, of course, local radio, local television, local newspapers, etc. So it's up to us how we plan and get draw attention amongst policy and decision makers, which are our target groups. And please never ever go to media without a good message. First, you have to invest. Sometimes it's better to invest a little bit more time to develop good message, maybe good messages, more messages for more target groups, for national, regional, local level. We can develop several good messages, and then we can use those messages quite much more easily in our media activities. Those messages could be provocative, because especially if we are civil society organizations, or even if we are researchers or scientists, we can produce provocative message and still keep a dignity and responsibility in communicating with public. So good messages are the key to draw attention and get coverage in media. Before we jump into action, we have to develop good media plan. After a few years of being advocate or being a member of coalitions, this could become quite easy task. It's not necessary to write this media plan in 5, 6, or 10 pages, but you can do it simply with bullet points. After you already know the processes, how you will organize yourself, distribute the tasks and roles between members of coalition, and which media are relevant, which channels you're going to use. Are we going to use Twitter, Facebook, Instagram? What are our target groups? So this is all sometimes very easy to plan, and after a while, being an advocate and coalition, you just need a simple bullet point plan and to plan your media activities. And there are absolutely, every time some key questions we have to answer. And those 3 are here. And you will get the PowerPoint presentation. And always, before you jump into advocacy, in media advocacy action, please ask yourself those questions and try to find good answers. Because if you don't, then your efforts will go to nothing, or you will lose the power of your advocacy activities. Because it is extremely important. We are not activists. We are not shouting on politicians what is wrong. But as advocates, we have to provide good arguments and good and possible solutions to put them into effect. And we have to find who is responsible to putting these solutions into effect. And this is more technical advice or hints. Before we do something with media in advocacy, it's always very relevant to make to develop a list and contact information on media, different journalists, different editors, which are important for our action. We have a huge list of media and journalists and editors, and you never ever send one message or one email to everybody, because you have to select who is important for your action, which journalist is important for your action. Maybe not everybody, because if it's, for example, finance-related issue on alcohol taxation, then some journalists responsible for health-related issues in the newspaper is not really relevant for our action. So we have to find somebody who is good and who covers financial issues in the newspaper or on television or on radio. So it's really matter who is important for our action, and then we select, we list, we create a list of important and relevant media counterparts or journalists or editors to send them our press releases or messages. Of course, we can always use general emails of media, but usually if they get thousands of or hundreds or thousands of emails every day, our message could be lost. So it's always good to create a list of journalists who are responsible for a particular topic and send also personal messages to those journalists. And also, before we establish contacts with them, we have to first prepare the message. We have to distribute roles and tasks among members of the coalition. We have to select the speaker and the reporter. We have to prepare relevant materials, additional sources, information if they ask us additional questions. But never ever send them a big studies or publications with 100 or 200 or 500 pages, because they will never read them. Always try to summarize on 3, 4, maximum 5 pages if the topic is more complex, and it's more likely that they will read those summaries. So you are the expert, you are professional, you know how to summarize the key information from bigger studies or research. So this is our responsibility as advocates to do this, not the journalist. Sometimes it happens that we send them press release and they simply copy paste it in the newspaper with maybe some additional quotes from opponents at the end. So this should be your objective. So you prepare a good quality press release and they just copy paste it and put their name on the bottom of the article. And please never complain about copyrights, because in advocacy this is not relevant. In science it's relevant, but in advocacy it's beneficial if they copy paste your press release directly into the newspaper. So this is a plus. So very good if it happens. So don't ever complain about copyrights if they do that. Thank them for collaboration and support. That should be the only action you take. And there are several methods of using media in advocacy, and they're all listed here. The most common, the most popular are written here. There are much more. You can use media in many other ways as well, but those are the most relevant and important. And usually at trainings, which are 2, 3, 4 days trainings, we try to teach people also how to write press releases, how to organize press conferences, what is important to organize good and well-attended press conference, how to write in social media. So all those things are available in our trainings if somebody decides to participate, attend our trainings. So press releases, it's important to know about some key rules. It's similar to rules about writing an article in newspapers. So every journalist can give you a good idea, good hints and tips on how to write a good press release. They should look like articles in newspapers. That's the most most powerful press release, because if it looks like article in newspapers, it's more likely that they will just copy paste it and maybe add some additional comments at the end of it. Or if it's too long, they will simply summarize it and use pretty much key information in their own articles. So there are several rules, and I just gave you. I just put some examples on the slide so you can see key rules, and if you follow them, it's more likely that your press releases will be successfully published in different media. Also, correspondence columns are not anymore so popular, but blogs are more and more popular. I will give you one successful blogging, 16 rules for successful blogging. It's infographics. I hope you will be able to see it, to open it and make it bigger. It's a small infographics. Just download it from the chat and open it, make it bigger, and there are some key rules, 16 key rules about how we can successfully blog. The blogs are important to follow the stories. So if we have a long-term advocacy campaign, we can write the blogs and add new information and discuss with readers about some solutions. People can respond. They can give us some feedback, some good ideas on how to proceed with some campaigns, etc. Those blogs are, some of them are really popular, and there are under some of them are quite good and relevant discussions between different professionals or general public as well. So it's always good to use them if we have a long-term advocacy campaign, to follow the story, to add new stories, to add new information, to add new materials. So everybody who is interested to follow your story, including journalists, they can go there and follow the blog thread every time they need some updates from the campaign. Also, traditional methods of using media like interviews, TV, radio discussions, it's always good to be well prepared in advance. So you can train yourself in front of the mirror. You can develop or write 10 key messages, and then train how you're going to present those statements and messages to the media. Never go to the media unprepared. This is a death penalty, because if you don't do the work well, media will not ask you in the next couple of years to speak to them anymore. So it is really extremely important that you do a good job when you have the opportunity to do it. Because if you do a good job, then they will invite you again. They will speak to you again. They will try to get additional statements in the future from you. So this is a good strategy to build a relationship with the media in the long term. So this is extremely important, that you respect the media, that you come dressed well, with colors which are neutral, like black, the dark blue, etc., and that are compatible to the colors in the studio, for example. This is also important sometimes to know, and also to adapt to the style of different shows. Some shows are very aggressive. They speak against each other all the time. They're arguing all the time. But some discussions, like interviews or maybe radio, expert radio discussions, are more quiet. You have more time to express your opinion or statements, etc. So you have to really be prepared based on the format of the TV or radio discussion. So social media, all about social media. We are all on social media. We're using Facebook, Instagram, YouTube, Twitter. But for policy, for media advocacy, especially with the policy and decision makers as our target groups, I would say that Twitter is the most relevant social media at the moment. Especially if I speak from Slovenian perspective, all politicians, all relevant discussions, relevant for future and present policies, are on Twitter. And if you are not on Twitter, then you don't exist. So they don't know about you. They don't know about your arguments. So sometimes Facebook is already out of date. Mostly my generation is using Facebook. Parents are using Facebook to follow their kids and to communicate to each other. But politicians and also journalists, media, they use more and more Twitter in those times. So using Twitter is very good recommendation for all of us who want to be successful in advocacy. So this is maybe one example of our advocacy campaign on Facebook. So you can see that with the good tools which Twitter or Instagram or Facebook offer us, you can really get a good attention, not media attention, but attention by policy and decision makers, and also by other target groups. For example, parents in this case were our target group. So you can use Twitter or Instagram or Facebook ads, a tool. You don't spend too much, and you can get really good coverage and I don't know how to say it in English. You can reach. You can really get a huge reach if you know how to use these tools by social media, including politicians. If you know how to use hashtags and tags and those kind of tools in Twitter, you can really sometimes get good attention. And even an answer from politicians, high-level politicians, they respond sometimes to your tweets. You couldn't imagine that we first, when we got a feedback from a minister, we were kind of shocked, but now we are used to it. So we know how to use Twitter. We know how to provoke policy and decision makers. So we sometimes get feedback from them as well. So they see our posts and respond to our posts. And just for the final minutes before I open to some questions and to some additional comments, you will see on the final 2 slides also some ideas how to develop a good advocacy plan. Those are the steps described for each advocacy plan, and some hints and some questions we should answer before we proceed with with further steps in advocacy plan. So you will be able afterwards to read those hints and questions. But during the trainings, 2 or 3 or 4 days trainings, we actually give participants a possibility to work in groups already, maybe in a kind of coalition groups. They, after the training, they try to develop effective and advocacy plan, which they could take it at home, and also they could start implementing it immediately after the training. So this is usually the best possible outcome of the training. So people go home and they immediately start with advocacy action because they already have a kind of draft advocacy plan ready for implementation. So those are further steps, how what we should think about it in the phase of developing messages, what kind of products or materials we should develop, which channels we should use, and how we can monitor and follow our responses and get maybe also some good evaluation report at the end of advocacy campaign. Evaluation is also important because evaluation gives us usually a good idea how to organize ourselves in the future. It gives us an idea how successful we were with advocacy campaign, and if we were successful, then it's good for motivation and future advocacy work. So it's always good to evaluate our work as well. So this is all I have to say in this workshop about this topic. So please, if you have any questions or ideas, comments, you're more than welcome to put it in the chat, or just you can also raise a hand and say it loudly. And thanks for your nice words about the session. I really appreciate it. But you know, this is the 90% of the content of this workshop is based on our own experience with advocacy. But more and more in recent years, there is a scientific background for what we are saying and what we are teaching others to do in advocacy. We also collected a lot of scientific articles on advocacy. Also, if you're interested in these topics, you can always write an email to me, so you can take a photo or copy it from the slides, and you can always come to me by email and ask for more information, including some advocacy manuals, advocacy training manuals, articles on advocacy, maybe on particular issue you're interested in. There are several articles on alcohol policy advocacy, a lot on tobacco, a lot of junk food advocacy activities, physical activity as well. So a lot of scientific background for this workshop, and I'm happy for that. So what we learn from experience, it's coming to science as well. Thank you very much.
All right, and if there aren't any questions, anyone? I don't think so. All right, well, I just want to thank Mate for a great presentation and thank everyone for coming today.
Yeah, there is one question. Is media literacy being used in your country? You mean media literacy as a part of trainings? I think media literacy is extremely important, not just for advocacy, but also for all what we do in substance use or prevention, treatment, or recovery. Because especially if we are scientists and researchers and we publish scientific articles, we should be able to summarize and articulate our statements and our conclusions also to general media, to traditional or social media, and exchange this, share and disseminate our results. So in this case, media literacy is extremely important in our field as well. So we are able to use media as much as possible to bring our conclusions and scientific knowledge to general or professional public. Okay. So we are just on time to close this session. So thank you very much for being with us. And I hope we'll see each other once in the near future in person.
Yes. Thank you, everyone. I hope you enjoy the rest of the conference.
Yeah, I will try. There is a good program, so I will jump to some other session as well. Thank you. Bye-bye.
Thank you, everyone.